Okay, good afternoon, everyone. My name is Pierre Demian. I'm Senior HR Analyst from the City of Carson. Today this is for open enrollment. We have today Kaizer Permanente. We have Sunny, who is going to be giving us information about what Kaizer has to offer and the different plans, option, and everything else that goes on over there. We're going to start by the presentation, and then after that we're going to have a questions and answer session, Q&A. Okay, Sunny, it's all yours.
Great, thank you, Pierre. I appreciate the introduction. My name is Sunny Smith. I'm a territory manager for Kaizer Permanente. Been with the organization for over 5 years, 8 to be exact. So today I'm going to be spending time walking you through the CalPERS open enrollment presentation. But more importantly, if you have questions, you can put them in the chat feature, and Pierre will be helping me to moderate and field those questions after the session, or we will also be taking the phone off from mute, and you can ask any questions verbally. So it's your choice. There's no question off the table, so please let me know if anything comes up, because I know you usually come to these meetings with things in mind that you would like to know. The plan basically stays the same for active employees. There is a retiree plan. I don't know if anyone on the phone is a retiree, but I'll briefly go over those. So I will get started, and thank you so much for coming. Okay, so Kaizer Permanente, essentially, we are known for offering the commonly used services at one location. So we really connect our care experience to the customer. We have our doctors, our hospitals, and our health plans working together cohesively to provide comprehensive care to our member population. So it really starts with your primary care doctor and that care experience that is delivered to them. They have our electronic medical records that really helps them to navigate your whole health record and always have that record of you and any family members in the center of the care. So if you are on any medications, for example, they can see that. They can see any diagnosis a person has, so they can easily view that information very quickly in our system versus going through charts and charts of written records. So we love our integrated care model and that record keeping system. Also, our specialists, we have specialists in most of our locations. We've expanded lots of different service areas to include additional specialists, but our specialists and our doctors stay connected through that record keeping system. So if you need a referral to a primary care doctor, for example, the experience is very seamless. We will coordinate all of that on your behalf. So very easy to administer our program. The pharmacy is in each Kaizer Permanente location, except for the downtown location, which usually caters to the individuals who are working downtown Los Angeles or living downtown Los Angeles. It actually used to be my medical center. They do not have a pharmacy, but if you ever need to visit that center, you can use a local Walgreens pharmacy to have your prescription filled or go to a regular Kaizer Permanente facility. All of our facilities actually have laboratories, including downtown LA, which is one of our smaller centers. You can have any of your routine lab work done in our medical center, the same one that you administer all of your other care. We also have our digital options, and I talked about the electronic medical record system, but you as a member will also have access to those records through kp.org, so the health manager site, where you can do a number of different things, and I'll talk more about that later in the presentation. And we are also the insurance company and the provider of care, so that's what makes Kaizer unique. So we're not contracted out, we're not a third party, so we actually operate, own, and administer the organization as a health plan. Okay, so we are one of the largest programs in the nation, and in California specifically, we have 12.4 million members and growing. We were founded back in 1945, and our organization has been focused on medicine for 75 years. We have a large network of 39 hospitals and 714 medical offices and expanding, and I'll talk a little bit about those expansions as we move forward. Also, we have received 26 effectiveness of care measures, and those were around things such as cardiac care, managing diabetes, as well as managing stress and anxiety. So we are quite proud of those accomplishments. We are in 8 states. I actually started off in the Washington, D.C. office. I worked for Kaizer there for a few years before transferring to Los Angeles, where I'm from. So I will move forward. Okay, so why choose Kaiser Permanente? So we have our emphasis on quality of care. We are attracting wonderful physicians to work within our network of providers. We actually just opened, even with COVID, our new university for practicing physicians to be trained, and that's going to be in Pasadena. So we are excited about that undertaking, but we're attracting wonderful doctors as well as some new physicians as well to expand our network of providers and specialists, of course. So I always talked about us being one of the largest nations in, health plans in the nation, especially with a large footprint in California. We have our digital options such as phone and video visits. You can also chat with the nurse at any time or speak to them 24 hours a day. We have an advice line. Also, you can connect with your kp.org website at any time by downloading that app. You can do some really great things on that app, such as email your doctor, view your labs, refill a prescription, and if you have any medical bills that you would like to pay, that can be done on that website as well. So we have some new exciting member perks. So we continue to have, I don't know if you know this, some people don't, we have a chiropractic acupuncture benefit attached to the plan that's handled outside of Kaiser. So we are contracting with American Specialty Health Network. And with that network of providers, as long as you stay in that American Specialty Health Network, you can access up to 20 visits a year of any combination of chiropractic acupuncture with a $15 copayment. But remember to stay in that network. And I can give you information on how to find that information. Massage therapy, we have discounted rates on massage therapy. We have a diabetes prevention program available through our health plan. There's some great information on our microsite about that. You would go on and take a 2-minute survey to see if you qualify for that program. It's 12 weeks. It's absolutely fantastic. And on that program, it allows you to take the survey and it will invite you to attend if you are pre-diabetic. This is for individuals who are at risk, not someone who's already diagnosed. ClassPass. So we actually just launched a new program in partnership with ClassPass. They will not only give you discounts on things like training, online training sessions with world-renowned experts, fitness experts, but they also have on-demand classes available for no charge to our Kaiser Permanente member population. So that's a nice member perk that we just added. Also very popular, especially during COVID and times of social distancing. We have our Calm app as well as our MyStrength app that are available at no cost to all of our adult members. And I'll talk more about that later on in the presentation. Okay, so quality care is really at the center of our health plan, and it's a huge emphasis for us. So it really starts with prevention. We take a really proactive approach to medicine. We believe early detection leads to better outcomes. So we instituted a really robust preventive care strategy. system-wide throughout our health plan. Also, specialty care when you need it. So if you need a referral, again, I talked about how seamless that process is and how your doctor can quickly connect to a specialist. They can even do, if necessary, inpatient. So if you're inside a medical center, some of our newer centers have the ability to do a consult with the specialist, and you guys can have sort of a conference together via video. So they're all connected together, discussing your care and treatment options for certain conditions. That's really nice to have. Support for ongoing conditions. So we have support groups. We also have our resources that help members stay healthy, but also helps them manage any condition that they may have more effectively. We have our multilingual doctors and phone interpretation line with over 150 languages available. We also are hosting, as a health plan, Spanish-speaking open enrollment sessions to cater to our entire population, which I think is really nice. Okay, so I'm going to talk about convenient ways to get care. The unfortunate onset of COVID-19 on the unanticipated level that it has gotten, we have now sort of transitioned, as well as most health plans today, to more of a virtual care concept. We don't want members to have additional exposure to the medical centers when it's not necessary. So anything that could be handled over the phone or video, that's how we are conducting 80% of our appointments at this time. So those appointments remain available. We also have our advice line, and I talked briefly about that, but you have an advice nurse. So she's a licensed, registered nurse, available 24 hours, 7 days a week via phone to answer any medical related questions that you have. So that's a really nice benefit. If like, let's say, for example, if you have small children at home and maybe your child has a temperature or would be exhibiting certain symptoms, you can call the nurse and get some advice, and they will let you know if they think you should go to the hospital to seek treatment. They can even schedule an appointment on your behalf, so that's pretty nice. Also, you can email your doctor for non-urgent questions, and that's through the kp.org portal. They tend to get back to questions within 24 to 48 hours. Okay, so we talked about managing care. So you can schedule or cancel your routine appointments on the kp.org site. I talked about the ability to refill any prescriptions from mail order, and you can also check your medical records and pay bills online. So I hope, if you are a member or if you are thinking of becoming a member, I would highly recommend that you register to kp.org. It's a wonderful resource for our members. Okay, so care while you travel. So some people are aware of this and others are not. So the plan covers urgent care services minus any copay you have. When you're outside of the Kaizer service area, you can go outside of the Kaizer network to get urgent care needs. Also outside of the country, you have urgent care benefits on your plan. There's also emergency coverage, and that extends outside of the US as well. So you have worldwide coverage for urgent care and emergency services. We have our partnership with both MinuteClinic and CVS for situations where people are outside of a Kaizer service area. So if you're traveling to another state, for example, if you were traveling to New York, there's no Kaizer there, but there's MinuteClinics and CVS. So that's just an example of how you would access those services. Also, it is not on here, but I will tell you, we do have a new partnership with Target Clinics. So if you need, and they do offer a wide range of services, so you can find out information on that as well. If you need vaccinations or refilling eligible prescriptions in advance, so let's say if you're having an extended travel, say you're going on a long vacation, you can definitely utilize these services. There is the phone number for the travel line if you have questions, and there's also a website for questions. Okay, so this just talks a little bit about how our specialists manage care. So the two areas of focus are cancer care as well as cardiac care. So we have a team of specialists really focused on cancer treatment. We have a multidisciplinary team that take the best approach of treatment for our member populations. And same thing with cardiac care. So we really believe in customized care. We know no two conditions are alike. So we really work to diagnose that individual and give them the best treatment options for them. If you would like more information about cancer care or cardiac care, we have specific websites set up to provide that information to you. So kp.org/cancer care is for cancer, and kp.org/cardiac care is for any cardiac care concern. Okay, so what to expect when you're expecting. So we try to make sure we serve all of our members' needs at these open enrollment meetings. So there's some information about prenatal care, how we have a dedicated team that will be there for our expecting moms. Also, we have a personalized birth plan that's available. We want to make sure our expecting mothers have a positive experience and help them start their first appointment. There's care and support along the way, as well as support that doesn't stop at delivery. So we have ongoing consultation around breastfeeding, as well as some guidance around helping your baby stay healthy. If anyone wants to learn more, they can go to kp.org/maternity for additional information. Mental health. We have seen an uptick in mental health related appointments, especially due to self-isolation and COVID. So we will treat a variety of different aspects of mental health, so anxiety, depression, substance abuse, autism spectrum. We have both psychiatrists and psychologists available, marriage and family therapists. And here are some of the apps that we have available for our member population. So there's the self-care app, Calm, as well as My Strength. I talked about those, and those can be downloaded. We have the ClassPass that offers the fitness membership. We also have wellness coaching by phone, a number of services and member perks that will help our members manage their health more effectively. So we have the podcasts and recipes. We have currently stopped our seasonal farmers market for now. We have health education classes as well. And you can go to kp.org/classes to learn more. And this is about Calm and My Strength. So Calm is a really popular app now. I don't know if anyone's seen the commercials, but there's a number of great things you can do on the app. So there's a 10-minute daily Calm meditation that's available for someone to listen to daily. There's also guided meditations to help with anxiety, stress. There's sleep stories available. My Strength is also a great program. It gives you personalized and tailored program recommendations and feedback and coping mechanisms. Really focuses on reduction of stress and anxiety, and it gives you a lot of great meditation and mindfulness activities to help you get on the path to better mental health. Okay, and I talked about ClassPass earlier. The reduced rates on fitness classes are available, as well as the online video workout library with over 4,000 plus on-demand fitness classes available for you at no cost as a Kaiser Permanente member. We also have the Amada Digital Health Program that really helps our member population reduce their risk for contracting type 2 diabetes. You would just take the survey to see if you qualify. If you are at risk and qualify, you will work with a professional health coach. You'll have a peer support group, and they also send you a wireless scale to monitor and track your weight loss. Okay, so if someone is interested in joining Kaiser Permanente, it's really easy. You would talk to your health benefits officer, and that would be your human resources benefits department, also known. Also, we have if you wanted more information before making your decision, you can visit our microsite at kp.org/CalPERS. All of our members receive a welcome call as well as a member book to help get them started, help them navigate some of the important new things for members, such as help and support with choosing a new doctor, transitioning their care, so transferring any prescriptions that they may be on over if it's a maintenance medication, for example. Also, they can support you with getting care and scheduling an initial appointment with the doctor. And if you wanted to learn more about those services, you would go to kp.org/new member. Okay, so I am almost done. So choosing a health plan is a really big decision. So we have some resources here to assist you. I talked about those additional perks that are available. We have our video visits, our podcasts available for our members. There's the 800 number if you have any questions. They're available for any questions that someone has regarding the Kaiser Permanente plan. They're available from 7 to 6. I think those hours are actually expanded throughout open enrollment, and I think they are taking calls till 8 p.m. So you can jot down that number if you're interested. Okay, so these are the basic benefits. I'll just kind of quickly run through those. There's a $15 copayment for your physician services. That also includes urgent care as well. It's not on here, but if you are seeking care in an emergency room setting, there's a $50 copayment. If you need to be hospitalized, there's no charge for hospitalization. That would include an inpatient surgery. Prescription drugs, $5 for generic, $20 for brand through a Kaiser retail pharmacy. If you use the mail order, you get a copay savings. You get a 100-day supply at $10 for a generic and $40 for brand. You have those no-cost services with the 24-hour nurse line and wellness coaching. The wellness coaches are great. They help you to achieve any health-related goals that you have, and they will work with you to do that at no cost. Chiropractic and acupuncture, I talked about that in the beginning, $15 copayment, 20 visits, but you have to utilize the American Specialty Health Network. Okay, this is for our senior population. I'll just briefly leave that up, but this is also available on our website. I don't want to run out of time. So here are Northern California, I'll skip that. And here's our Southern California locations. I talked about the number of health plans and medical centers we have. If you would like to see which plan and medical center is near you, you can go to kp.org/locations and find a center that is convenient for you. Okay, so new locations in Southern California. Our Playa Vista Medical Center which is right near my home. Great medical center. We just had our ribbon cutting ceremony last week, so they're open now. We're excited about that. Claremont Mesa, and then you can see the other ones scheduled to open soon. Okay, so on behalf of Kaiser Permanente, we'd like to thank you for joining us today. If you have any questions, We're going to take the phone off mute and I'm going to turn it back over to Pierre. Take note of the website, CalPERS, kp.org/CalPERS, as well as kp.org/new member. Great information on those sites. And I'll turn it over to Pierre to see if there are any questions.
Hey, Sunny, thank you. I did not receive any emails with any questions, but I have some questions that, just to get general explanation. Now, through Kaizer plan, participant can go do their eye exam, right?
Yes. So with Kaizer, there is an eye examination benefit. So everyone on the plan can have their eyes examined with one of our optometrists. Certain locations have optometrists. We also have Vision Essentials available in Southern California. So if you've ever seen those around, they also have optometry departments there, as well as they also sell glasses and contacts there. So it's a pretty comprehensive vision center. But yes, it's available as a benefit.
Okay, all right, that's all
And
good.
I did get a question that came in, but I will address it because it was addressed to me privately.
Okay, all right. I know you went over it, but if somebody gets contracted with COVID-19 or one of their family members, another covered member, they'll be covered as with any regular illnesses that are covered with Kaizer?
Okay, I'm sorry, Pierre, do you mind repeating the question?
Yes, if with somebody, if a participant in the plant would contract COVID-19, unfortunately, would they be afforded the same coverage as all other patients?
Yes, so there's no exclusion for someone having COVID-19. There are parameters around testing, but there's not any restriction for COVID-19 members. Now, there is what, I guess, it gets a little tricky when you talk about, I shouldn't use the term tricky, but if someone contracted COVID in the workplace, for example, that will be covered under workers' comp as a workers' comp claim. But if someone didn't contract, which will be hard to know or determine, but if it's believed that if it's handled as a routine medical visit and someone has COVID, they would then, be treated by our physicians, etc.
Okay, well, last question that I have is, and this is just for reference record because I kind of already know the answers. How are immunizations and things like flu shot are handled through Kaizer? Is it what would be the copay and such items?
Yeah, no, that's a great question. So with COVID, we've seen an uptick. So we usually do some on-site clinics for our customers. That is a fee-for-service item, but we've actually opened up a number of expanded flu clinics. So we're doing flu clinics on Saturday, for example. We are doing drive-through flus so people feel more safe and comfortable. They don't have to get out their car. To do that, if you want more information, you can go to kp.org/flu, and you can see what locations are near your home or office. And then there was a question that came in from Christina. I'm going to answer her question in the chat since it was sent to me privately. I just don't want her to hang up because I want to put a website address for her to have that she'll be able to address her the portion of her question with. So before I end the call, I wanted to make sure I give that information to her, if you don't mind.
Yeah, that's okay, Sonny. Go ahead. Take how much time you want to have for this. In the meantime, if I know we were joined recently with Gina. Gina, do you have any questions for Sonny? Okay, I'm not seeing any more questions, but just let me know whenever you're done with answering, because I don't want to end the meeting until, we have
Thank
full
you.
answer. You're welcome anytime. Actually, Sunny, I remember before we started,
Yes.
you did mention to me that Kaiser is going to be holding a couple of sessions or a number of other sessions available for open enrollment through Kaiser's own website, including
Yes.
one in Spanish. If you want to speak a little bit more about that, that'd be nice.
Yeah, so and you can get that information. So we sent the information. We don't send out the invite. We let the organization send it out. But we actually have meetings available, and I'm posting some of those on Tuesdays, Wednesdays, and Thursdays, twice a day. Uh, that so with someone like myself, a representative is speaking regarding Kaiser for a period of about 18 to 20 minutes, similar to what I did today. Today was a little longer. And then we're opening it up for questions and answers. Also on the portal, you can take a guided tour, for example. You can also download any materials that you need. All of that information is available on the site. And during the live session, there'll be a team of question and answer moderators that are there to assist with questions you have through the chat feature. But it's a really good way to learn more about the program, get information, and have your questions answered.
Hey, thank you, thank you, thank you. I'm still waiting also for that confirmation from you that you did
Yes.
provide the answer.
Nope, I had a follow-up question, so.
Yeah, okay, that's good. Okay, in the meantime, I'm going to go ahead and end the recording. The
Okay.
meeting will still be going
Yes.
on.
Yep, I answered my
Yes.
final question.
Okay.
So thank you, and I appreciate everyone coming, and I wish everyone a great day. And thank you, Pierre. If you need anything, please let me know. I'm happy to answer any questions you have. If you would like to have that flyer, I'm happy to email it to you as well.
Please do so. Email it to me. It's pdemian@carson.ca.us. Let me make sure that I send it to you.
Carson.
And we'll go
So
ahead
your
and post
first
it on.
initial last name at carson.ca.us.
Yes. Yes, we'll go ahead and post it if it hasn't been posted already to our city website. Again, this meeting has been recorded and it will be made available for all employees through the city's YouTube channel until the end of open enrollment, which is October 16. We encourage all city employees, those viewing it currently and those who will be viewing the recording, to make sure that they complete their open enrollment documents before the deadline to avoid any problems and also to count for possible IT. I usually tell people to try to at least finish it 5 days before the deadline. And if you have any questions regarding Kaiser or its wonderful products, please visit the websites. You can also contact their member services directly, or then I'm pretty sure they have a number of hotlines that are going to be available online. And again, Sunny, on behalf of the city and the Human Resource and Risk Management Department, we'd like to thank you for this wonderful presentation.
No, it's my pleasure. Thank you for having me, and I wish everyone a great afternoon.
Hey, thank you too.
Yep,
And
thanks.
now
Bye.
we're going to be ending the meeting. Have a wonderful day.
Thank you.